Welcome to part 2 of this video on managing and diagnosing ADHD in adults. I'm Dr. Hamelijnck, consultant psychiatrist. In the next 10 minutes or so, we'll be talking about the main treatments of ADHD in adults. Next slide. When people start treatment, it's very important to first realize if there's any physical health investigations that need to be done. Most stimulant medication can cause a rise in blood pressure and pulse, and therefore this needs to be checked before starting treatment. A family history of any heart difficulties like sudden death needs to be investigated. An ECG is not normally required as a routine, and neither are any routine bloods, except if the non-stimulant atomoxetine is used. The aim for the treatment is to start on a low dose and to slowly increase until the required level of medication has been reached. The patient is offered ongoing support during the titration of medication, either on telephone or email, to see if there's any emerging side effects and to adjust the dose. After medication has been started, the blood pressure and pulse should be monitored annually by the GP. Next slide. The first line treatment in adults with ADHD is similar to children with ADHD. Stimulants are the first choice. There are two main options in prescribing stimulants. First one is methylphenidate, and the second one is amphetamine, which is now being provided through a preparation called lisdexamfetamine, which will be covered in a later slide. Stimulants provide a slow, continuous blockade of the noradrenaline and dopamine, and should be given up to a dose of 100 milligrams a day. It's important to realize that stimulant medication does not provide 24 hours a day cover of symptoms, but the response rate is very high. New slide. Side effects for stimulants are very mild. Most people will have no difficulties. Occasionally people will experience headaches or sleep difficulties, and blood pressure and pulse should be monitored if required. No routine ECG is necessary. The worry around stimulants is the abuse potential. In reality, this proves to be quite a low potential. Drugs of abuse have in common that they tend to be high dose and a fast delivery. Just think of the delivery of cocaine through the nose. In stimulant medication with ADHD, this does not happen. The medication is swallowed, and therefore there's a slow uptake in the stomach and gut. There is no quick emergence of effect leading to a low abuse potential. New slides. Methylphenidate has been around for a long time and is the first choice of stimulant medication. Normally, I would start patients on a dose of 5 or 10 milligrams twice or 3 times a day, and monitor weekly to look for response. The main effect of methylphenidate is people recognize an almost immediate improvement in their ability to focus and concentrate. They get more things done. They're able to organize themselves better. But this will last for a few hours for a normal release preparation. This raises the possibility of considering modified release preparations like Concerta or Equisim, which will give a more smoother response effect. New slide. Amphetamines have long been known to be very effective in ADHD, but the immediate release preparations caused concern with regards to abuse. Amphetamine, just like methylphenidate, blocks the noradrenaline reuptake molecule, but in addition to that it also has an effect on the dopamine reuptake molecule. The other main difference with amphetamines is that it causes an active release of noradrenaline and dopamine at the nerve terminal, leading to very significant effects. Due to the slightly higher abuse potential, the pharmaceutical industry have brought out lisdexamphetamine. This is a prodrug of amphetamine with lysine, which gets split in the red blood cells, leading to a very slow but steady and smooth release of amphetamine in the bloodstream, and therefore leading to a very low abuse potential but very good effect on ADHD symptoms. New slide. The second line treatment in ADHD in adults is through noradrenaline reuptake inhibitors, and the most widely prescribed medication is atomoxetine. This is at the moment the only licensed drug for UK use in adults when started in childhood. Tricyclic antidepressants have long been used in managing ADHD and can be very effective. Bupropion is a noradrenaline acting drug, but the effect on ADHD symptoms is not huge. New slide. The main side effect for noradrenaline reuptake inhibiting drugs are similar to stimulant drugs, but there are some additional difficulties. Just like antidepressants, they can cause some sexual dysfunction, sweating, and there have been reports of suicidal ideation. Also anticholinergic side effects like dry mouth and difficulty focusing when reading can occur. In my experience, these symptoms don't tend to happen very often and are often easily managed by the patient. New slide. A further drug is a noradrenaline agonist, and Clonidine is the most widely prescribed drug in the UK. Clonidine is quite a sedative drug and is therefore very helpful to be used at night. Sometimes Clonidine is used in addition to stimulants to help patients shut off their mind and enable them to sleep. New slide. Clonidine has also been helpful with the use of emotion regulation difficulties like aggression and anger. There is a hypothetical increase in tics when stimulant medication are prescribed, and Clonidine could be a better option for patients with an existing diagnosis of tic disorder. Because of the hypertensive effect, blood pressure needs to be monitored carefully. New slide. As a third-line treatment, people may need to be prescribed a combination of drugs. I already mentioned the combination of Clonidine with stimulants, but also other noradrenaline reuptake drugs like atomoxetine with stimulants. The use of these is not very common. Antipsychotic drugs like quetiapine are used in managing ADHD symptoms, particularly aggression, and there is some pharmacological evidence that this should be helpful. However, in reality, quetiapine is more of a sedative, and some patients find it helpful to sleep. NICE guidelines are very clear that antipsychotic drugs should not be used routinely in patients with ADHD. New slide. I would like to end this presentation on adult ADHD to draw your attention to the difficulties of prescribing when your patient becomes pregnant. There is not enough data to say that methylphenidate is definitely safe, but the risks are likely to be very low. This has to be balanced up with the risks of the mother when she is not taking any medication, particularly high risk taking behavior and impulsivity. It's worth considering stopping the medication during the first trimester and also before giving birth, or to reduce the dose to the lowest dose that will manage the symptoms satisfactorily. When the patient is prescribed amphetamines, the advice is to change to methylphenidate. Thank you very much for listening to this presentation on adult ADHD, and I hope you enjoyed it. Further information can be found on our website, Anchor Psychiatry Group.co.uk. On this website there will be further links to national resources from the Royal College of Psychiatrists and other organisations, including ADHD Norfolk. Thank you.